So now we're on to limb development, which I think we'll find is a lot more straightforward and a lot simpler than some of the other systems that we've gone through. So by way of an overview, limb development primarily occurs between weeks 4 and 8. Now, of course, they grow and lengthen past week 8, but most of the actual development occurs in this period. And limb development starts proximally and proceeds distally, which makes sense. We talked about in previous lectures that the limbs actually bud off of the sort of presumptive shoulder and hip regions, and then they extend outward from there. Now, the upper limbs start developing first around day 24, with the lower limbs following around day 28, although they will finish about the same time. But it's worth knowing that they start at different times, because limbs are one of those things that tend to be affected by exposures, and that's one of the things we'll go over in one of the group projects, and the book talks about it a little bit as well. But if you're looking at an exposure that affects limb development, and you say or have an exposure that occurred on day 26, you might expect only the upper limbs to be affected, whereas if it occurs on day 31, it will likely affect both sets of limbs. So it's worth understanding there's a small difference there, although again they do finish up about the same time. Now the structure of the limb bud, it's a mesodermal core with an ectodermal cap, which makes sense. Mesoderm on the inside, muscles and bones, and ectoderm skin on the outside. The mesoderm will induce the ectodermal cap to form something called the apical ectodermal ridge, which is critical for continued development of the limb. Damage to that particular structure produces some fairly severe limb defects. Okay, so we're going to go through a timeline. Your book does a nice job of this. We'll hit the highlights here, but it's really laid out very nicely in the book if you have any questions. Okay, so starting on day 33, and they've started this timeline a little bit into the process, so we're not starting at the very early bud, we've gone a little ways down that road. But for day 33, in the upper limb, we have at this point a hand plate, which is what's in the purple box there, which is the future hand, along with a forearm, an arm, and a shoulder, which are all, a little hard to see the difference in this picture, but basically there are regions you can suss out based on sort of little dents or changes in shape along the length of the limb bud. The lower limb, not as far along. We've got sort of a foot region and a leg region, but not much else. For day 37, by that point in the upper limb, the hand plate now has two separate regions of its own, a carpal region and a digital plate. Now carpal, if you think about carpal tunnel syndrome, that's a wrist issue. Carpal bones are in the wrist. So it's got a wrist region, and then the digital plate would be where the fingers will ultimately be. The lower limb is now further subdivided into a thigh, leg, and foot, but as of yet, not any further distinction there. Now by day 38, things are getting interesting, because in the upper limb we now have finger rays, which are the future fingers. So they occur in the digital plate, of course, and what's going to happen, both for fingers and toes, is that the cells in between the future fingers are programmed to die. That's part of their normal developmental process. And as they die, they will leave spaces between the fingers that will extend, and the toes as well, until you have fully functioning fingers and toes. I think it's a very clever system. At any rate, if we look at the feet, or the lower limbs, we've seen some increase in length, and now we have a foot plate, where ultimately we will have a foot, but no toe rays as of yet. So by day 44, we've started to see some of that cell death between the finger rays, and the fingers are starting to separate, although clearly they are not entirely separate. And we've got now a bend at the elbow, so we've got sort of a future elbow in process there. In the lower limb, now we can see toe rays, but no separation between toes as of yet. And then by day 47, the upper limb has begun what's called ventral flexion. Essentially the arm is able to flex toward the midline, and it sort of positions the limbs in a sort of characteristic position for babies of this gestational age, although of course ultimately they are able to move their limbs and alter position in whatever way they wish. The lower limb, you also start to see some ventral flexion, and the toe rays are becoming more prominent, although still not separate. By day 52, you have a proper bend at the elbows of the arm, and the tactile pads are developing on the fingers. Now the tactile pads, it's on the palmar side of the finger, and that's where you Those are just regions of intense sensation, temperature, pressure, pain. If you think about your fingertips, they are highly sensitive, and those are developing around day 52. The wrists now are flexed and the hands are able to meet at the midline. So we're achieving some of that more mature appearance to the upper limb. The lower limb is continuing to lengthen. It's now flexing towards the midline, although it's not there entirely, and the toes have now begun to separate. By day 56, we should have completed development for all of the limbs. And while, again, they will continue to grow in length and in size, all of the structures should be complete. Now, in addition to the growth and development of the limbs also undergo a rotation, both upper and lower limbs. They rotate around the long axis, and the purpose of that is to move the elbows and the knees into their proper position. So if you look at this picture, if you focus on the feet, and so in A and B, they've highlighted the plantar surface of the feet, that's the bottom of the foot, which is facing sort of outward. Whereas in picture C, after rotation, now the plantar surface of the foot is facing downward, as it would in an adult, and the dorsal surface or the top of the foot is facing up. An interesting side effect of that rotation is that, of course, all the nerves and muscles within the limb are rotating too, and so you get a spiraling pattern of nerves and muscles as a result of this rotation. Okay, so we're going to go over the different tissues that compose the limb. A lot of this will be reviewed because we've talked about all these tissues individually in other sections, so we're just sort of putting it all together for the limbs. Okay, so as we know, limbs are derived from multiple different tissue types: mesoderm, somite derivatives, neural crest cell derivatives. The mesoderm contributes the bones, the ligaments, the tendons, and the dermis of the skin. From the somites, we get the muscles and the endothelial cells. Remember, the somites are, those tissues are migrating to the limbs from the region of the spine. And then we also have the neural crest cells, which again are migratory cells. And as they move into the limbs, they form the melanocytes and the Schwann cells. Now, it's been several weeks since we talked about this, but remember, limb bones develop via endochondrial ossification, which means that a cartilage skeleton is laid down first before the bones ossify. There's a picture here as a reminder for anyone who has questions about that. Now, the clavicle, which is kind of sort of a limb bone, is a membranous bone, but most of the limb bones are developed via endochondrial ossification, and we aren't really going to focus on clavicles in this particular lecture anyway. Okay, so forming a skeleton. Week 5, we start to see mesenchyme condensing within the limb buds, and that's going to be the future bones. Initially, we have the proximal skeleton laid out, so for the upper limb, that would be the scapula and the humerus, and for the lower limb, it would be the pelvic bones and the femur. I've got a skeleton here as just a reference, so you can see where all those bones are if you're curious. By week 6, we start to see condensation of mesenchyme to form the distal skeleton, and I've listed some of the major bones there. So we've sort of gone all the way out through the carpals and metacarpals, which are the bones of the wrist and the hand. And then by week 7, we ought to have cartilage laid out for most of the bones, including the phalanges, which would be the finger bones. Although the distal phalanges of the toes, so the ones that are furthest out from the body, are not yet laid out in week 7. They will be by week 8. And then in week 7, ossification of the bones begins. So they go from cartilage to actual bone, and that continues through week 16, so it does take some time. However, there are some of the smaller bones of the hands and the feet that won't ossify until long after birth, sometimes into early childhood. Now the nerves of the limbs. So by way of reminder, the spinal nerve is going to split into a dorsal and a ventral rami, and it's the ventral rami that's going to contribute to the limbs. So the limb muscles are innervated by branches from this ventral rami, and they migrate along what are called permissive pathways, and they really are exactly what they sound like. So they're regions in the developing limb bud that is possible for nerve cells to migrate through. There's lots of the developing limb that they can't migrate through. So these pathways provide sort of an easy route for nerves to follow. They can't get out of them because they can't get into the surrounding tissues, and it ensures that the nerves get to where they're supposed to go. Now, the motor axons, as they progress through the limb buds, will ultimately merge and sort of group together to form a brachial plexus, one for each upper limb, and a lumbosacral plexus, one for each lower limb. And those plexuses sort of serve as control centers or sort of organizing regions for the neural activity of the limbs. Once the plexus forms, nerves then continue to grow outward from the plexus to innervate the more distal regions of the limbs and hands and feet. All right, so there are lots and lots of limb anomalies, and your book has many wonderful examples. We'll have some others for you to look at in the course of the module, but I thought I'd highlight a couple just because they're interesting. So your book has this very nice table that lists not all, but many of the different types of limb defects. And this is worth knowing because if you're looking at a baby or a fetus in an ultrasound and trying to figure out whether or not there's a problem, what kind of problem it might be, it helps to know these terms. So in particular, if you're looking at a baby and suspecting dwarfism, if you want to try to put, say, the limb features together with other features the baby might have, it's worth knowing what is going on with the limbs that you can then, what term to use when you're looking it up to go along with other symptoms. So short limbs isn't really sufficient. Are the long bones of the upper arm and short? Is it the more distal bones? There are terms for all of these things. Okay, so a couple things first. So amelia. So amelia is just a missing limb, and in this case, this baby is missing the right arm. So you can actually be missing an entire limb, which would essentially be a failure of the limb bud to develop at all. This is ectrodactyly, a really interesting one, split hand foot. So you essentially get a hand that's, or feet, in many cases, that's divided right down the middle. It is a familial trait, and as you can see, here's a mother with 4 children who are all affected. In this family, it would be dominant. And actually, these are families that in times past may, in some cases, have worked in the circus or in show business, as sometimes called the lobster claw deformity. Not a terribly nice name, but reasonably descriptive. So at any rate, this is an interesting one, and certainly one that can be familial and often is. Rhizomelia. So this is worth noting because this is the shortening of particularly of the upper bones of the arms and legs that's characteristic of achondroplasia, which is the most common form of dwarfism. And of course, here we have Tyrion Lannister, or Peter Dinklage, of course, is the actor's name. At any rate, he has achondroplasia, and you can see the rhizomelia in his upper arms in this particular picture. And finally, syndactyly, which is an interesting one because a lot of times it's nothing, but sometimes it's something. So this is 2-3-toe syndactyly. When you're counting toes, number 1 is the big toe, and you go out from there. And same thing with fingers. Number 1 is the thumb, and you go out from there. So this is a failure to have that programmed cell death occur between the second and third toes, creating this fusion. Now, 2-3-toe syndactyly is characteristic and classic for trisomy 18, but also occurs as a dominant trait in some families, as it does in fact in my family. So worth knowing if you've got a family with a history of 2-3-toe syndactyly, so that if you see it on an ultrasound, you don't worry so much about the baby having trisomy 18. There are, of course, lots and lots of other limb anomalies, and some you'll read about. Others I suspect you will encounter over the course of your work if you continue down this road, but very, very interesting field to go into.